So today I'm going to demonstrate to you some of the post-operative exercises that are important to do for your knee after knee surgery. Specifically in your discharge instructions, I'll explain to you which exercises you should be doing after surgery, as not all of these might apply. So make sure you review those before the video so that you do the appropriate things. Now, many of you will have a knee brace that'll be locked straight after surgery, and sometimes you can unlock it and bend it and remove it, and other times you can't. So again, clarify with your instructions whether or not you're able to do it. Now, after all knee surgeries, the most important exercise that applies to almost every case is getting your knee straight again. So the number one most important exercise you have to do is get your heel on something higher than the bed or the floor, like a bump, a couple towels, and I have a box here. You want to put your heel on that. And the goal is, normally your knee will naturally want to bend a little bit when you do this, especially after surgery because you'll have swelling. But your goal is to actually straighten it out as much as you can, and then actually push down on your thigh. Lean into it as hard as you can. Again, you could use a chair as well. If you're sitting, put another chair under your heel, and you want to really push down and make sure you get all the way straight. It's okay for most surgeries, as long as it's in your discharge instructions, to push through the pain, because number one, you want to get that knee straight again. If you don't get the knee straight again soon after surgery, that could become a long-term problem, so you don't want that to happen. The other thing that you're going to want to work on is your quadricep strength. Now, many surgeries, you're not allowed to actually work on extending your knee. So what you have to do is let your leg lay straight. You may do this with the brace on, if you have a brace, and actually just work on, without pushing, getting your knee all the way straight. Even if it's already straight and you still push that way, to just get a little more straightness, that's tightening that quadriceps muscle and working it to make sure that you have the appropriate strength, helping to maintain the strength without losing or atrophying the muscle, essentially. The other thing you can do for certain surgeries, this does not apply to everyone, but if you can take the brace off and unlock it, then the thing that you can start doing is working on bending your knee. And you could do that in several ways. One way to do it is to actually just hang off the edge of the table or the bed and slowly let your knee start to bend. And you could notice if you let it just hang all the way down, essentially that's 90 degrees that you could let your knee bend. But again, after surgery, you may not get there right away. You might be at around 40 or 50 degrees. And eventually you use that stretch and help the pain slowly let you go down to 90. And that way you start getting your motion back to your knee. The other way you could do that, you could actually lay down. And if you lay down, you could slide your heel and get that same bending back to your knee again. Slide your heel back and then actually let the heel slide back forward. It's easier to do it on a bed with sheets rather than a rubber surface, otherwise it doesn't slide as well. So that's the additional exercise that you have to do to work on getting that motion back with your knee. Then the other thing that's very important, again, to maintain the quadricep strength as well as the hip strength, and it's easiest to do this laying down as well, and often I'm going to have you do this with the brace on depending on your surgery. Again, you check your discharge instructions for that. You're going to lay down, and whether or not your brace is on, what you want to do is just keep your knee completely straight and work on what we call straight leg raises. And you want to be able to do this 20 times in a row without difficulty with the brace on if you need to have a brace. So again, the straight leg raise is important, but number one is getting that knee straight, pushing on your thigh, having that out on a chair or in a bump like I had for my box. Then working on maintaining that quadriceps by just pushing that knee straight like I showed you earlier, working on the straight leg raises, and then letting your knee hang over the edge of the bed to try to get that flexion back. There are additional exercises that we recommend you do after surgery for certain procedures, and I'll talk to you about those before surgery if I don't have them in this video. Otherwise, I'll be sending you to physical therapy usually about a week after surgery, assuming that you have a procedure that needs that therapy. If you have any further questions, please contact the office and I'll be happy to answer them.